So I'd like to discuss some of the details around CDC's data, CDC's COVID community level, uh, COVID community levels, and some problems I'm observing. So if we go to COVID community level tracker, this is the website that determines COVID or provides COVID community levels of transmission, things like that. And they have created a new rubric or framework for determining the threat levels for different counties. It's on a county by county basis. And so there's 3 different levels: low, medium, high, and it's based on 2 different dimensions: COVID cases for that county as well as COVID hospital admissions. So anything over 200 is going to put you into the medium and or high. And then there's a second rubric that says, okay, if you're higher than medium or higher than low, which is over 200, then we look at the COVID admissions, and if that's over 10, then that's high for the area. The problem I'm seeing is that the numbers here that are being provided for the population are not being updated. And even though there's a note here that says the community levels are being updated on a weekly basis on Thursdays, this isn't actually happening. I don't know if this is like a disclaimer to absolve them of being malicious or something. But if we go down here, we take their number as 247.4, and we go down here. CDC provides the latest level data. Unfortunately, they don't actually provide the day for which the determination of low, medium, high was used. We see that this is actually lower than 200 for today, for the last 7 days. So, but if we do have that somewhat of the available data on the time series. And so if we go back to the 2nd, which is the last Thursday that this video is being made, we see that it's 156.561, and this is a per day case rolling average over 7 days. So if we're going to change it into the format that the CDC uses to determine its COVID levels, we need to do some calculation. So what I'm going to do here is I will pull up a calculator for you, and we'll just quickly do the math on the screen here so you guys can see what's going on. So if we since this is a per day average, we need to take that number and times it by 7 because it's a per day number. So this would be the average for that week. So we can expect Anne Arundel County had 1,095 cases for that week. And then what we need to do is divide it by the population per 100,000 ratio. And so to do this, and since the population of the county is said to be 579,000, we can just divide it by 5.79234, and this will get us the same conversion that is being used for the case rates up here. Now what's interesting is this number is way lower than the case rates for Anne Arundel County. And so for this week, the marking should have been for Anne Arundel County a medium level. And this is important because, well, it would have been below 200, which would have been a medium level. And this is important because this information is being used for guidelines for federal agencies to make COVID level assessments. And this also makes people feel like there's a threat. It makes people feel like there's something going on here when the actual levels are low. And for some reason, CDC just doesn't want to change it. They've been notified. I've notified them. They don't care. They don't want to change this number. They don't want to change this level, even though on Thursday they reported, based on that number on their own website, that the numbers are different. And I don't know if they do this conversion, they keep this conversion difference so people can't go on and clearly see it, but it's happening, and it's not being updated, and no one seems to have an issue with lying about the numbers or the case level within their own frameworks.